I think I discovered it through recommendations. There's a local moms group of moms of autistic kids. Boise Autism Moms is what it's called, and I'm pretty sure that I found out about the clinic through there, just people asking for recommendations, and we started coming. We moved here to Boise like 2.5 years ago. Yeah, we started coming, and Oliver, speech therapy doesn't necessarily is not the most interesting thing a lot of times compared to like occupational therapy or something where you're like moving around, but Oliver loves coming here. Runs to the door and like we have to hold him back from going back to Ryan's room most of the time because he just has a great time with her and like has made great progress. He was diagnosed when he was 20 months and he started various therapies shortly after that, and so he's been doing speech therapy since he was about 2, and he definitely did not love it then. He really didn't make that much progress because he doesn't have much speech. He's had a handful of words here and there. Right now he doesn't really have any that he uses, so he uses his iPad to communicate, but we've tried like all different systems, and he's definitely made the most progress with Ryan and with this clinic. I feel like he definitely connects best with providers who are super warm and who work at his level, and he's had some like that in the past, but she's definitely like one of the best, and she is super patient with him. We've had some ups and downs with like medications and things like that, so there have been times when he like was not attentive at all, and really didn't want to be in the session just because of other things going on, and it like never flustered her. Like she just rolled with it, and she's like, and everybody here is phenomenal. We go to another clinic for occupational therapy, and it's a very, like, the providers are good, but it's a very different setting. Like Katie and Rose are always great about greeting you when you come in. They know who everybody is at that clinic. They don't have a Katie or a Rose. There's just like, sometimes there's a random guy that sits at the reception desk, but he doesn't greet you. I don't think he is, office manager or a receptionist or anything like that. So definitely it feels very warm and welcoming. I guess it would probably be about this time of year last year. Oliver, I think we just kind of hit everything right with like medications and different things, and he was having like Ryan was trying different techniques with him, and he was actually producing quite a few words. And then we had to switch his medication because he started developing tics, and we haven't quite gotten that magic yet, but it was just amazing because you kind of expect kids, if they're going to have speech, to have it at a younger age, and he was he had just turned 6, and it was like great. And he his external appearance is completely different from like internally. Right before he turned 5, we realized that he had taught himself how to read, and he's able to like. Apparently he's been reading since he was 3. That's what he's told us, but we didn't realize. Ryan is using a different system with him because she wants him to be as independent as possible, and I do too. But I need to know what he has to say, and he desperately wants to speak, and it was like super exciting because he was actually getting there, and hopefully we'll get there again, but at least he has other methods of communicating, and that's the main thing. That's so we always try to follow his lead, and it's clear that he loves coming here, and it's not one of those things where therapy is just like one more thing he has to do, and it's like something he's dreading. It's great to see that he's looking forward to it. I think since being able to express himself is one of his main priorities too. I feel like he can kind of see the progress, and he just has fun here too. I think he has also made excellent progress with using his AAC device. When we were in the Nashville area, he attended a preschool for autism at Vanderbilt, and it was run by SLP, so that was really nice. And that's when he became introduced to AAC, but he was using a different program, and it was a symbol-based one, and he really didn't make that much progress with it. Like we started with that here with Ryan, he definitely made way more progress with her than he did there, and then we found a couple of different programs that worked for him better, so we've switched to those. But he just is able to like attend and do things independently. a lot more with her, and yeah, absolutely. And I've when I was reading over like an old evaluation of his, and it was a little bit after he started here, and I saw that it said receptive and expressive speech delay, and I realized, since after he was able to show me that he could type, he has no receptive delay at all. He understands everything. He just may not appear like he is. So I talked to Ryan about it, and she's like, oh yeah, absolutely, we can change what we're doing. And that's when she started doing the prompt method to try to get him to verbally speak. And yeah, they're definitely very receptive to like working with us and taking different approaches. And if something's not going great with him, just kind of changing tacks and or tactics, and just that we're super appreciative of everything. Oliver definitely has some unique challenges, even with compared to other kids with like similar conditions, and they never make us feel like he's too difficult or that they can't help him. They always seem like they are thrilled to see him and work with him. So that's just like really, really nice to experience.